Everybody will say about success, but nobody will talk about failures. Don't believe those people, those who are trying to depress you. They are the biggest killer of your own self. You are not that lucky in the matter of ENT and ophtha, because they are one of the strongest subjects which people think, and actually they are, but they were quite critical in the exam. In my words, I call FMG as a NEET PG prelims. Questions were very much twisted, and English was just like means we were sitting. Yes. I was going to say that. Nowadays, exam is getting 101% clinical. Detailed knowledge of all the 19 subjects is very important. Don't do rapid revision. It is very harmful practice. One-liners were very deadly.
And everyone was saying on center around me that paper was very easy, part 1 was very easy, and I was like, really?
Yes, correct.
Whatever grand test you solve at your institute, never try to compare it with your final score. So it's not 100% sure that you will score the same marks in your final exam.
हम भी दरिया है, हमें अपना हुनर मालूम है, जिस तरफ भी चल पड़ेंगे रास्ता हो जाएगा. So try to.
Before getting into the podcast, let me introduce my friend Dr.Nikhil Karemore. He recently passed his FMGE Jan 2024 exam with a decent score of 180 marks, and reason of inviting him on this podcast is to spread positivity because his perspective of looking towards things is very optimistic. So let's get into the podcast. This podcast will be helpful for all the upcoming NEET UG aspirants as well as foreign medical graduate currently pursuing their MBBS abroad. So let's dive into it. My first question to you is, Nikhil, please share your university name, region, and your university experiences you have or you had from first year till 6th year.
Actually, I was a student of O State University and I graduated in 2023. And means the important thing which I would like to mention here is we were the first 5-year batch of our college. That was the first thing, which is a very noteworthy point. And means 2018 batch was the first batch from which 5-year course was started.
Yep.
And that was the first thing which has drawn my attention, because every time when we go abroad to do MBBS, we have seen duration of 6 years.
Yeah.
And saving 1 year was a magical thing which I thought I'm getting, and I grabbed that opportunity. The university was cool. Why I'm saying it like that is, after having 2 drops, making means that phase was too much depressing. That phase was everyone was desperately trying to enter into the medical college, and something from a point of view that India is not giving us seats and all. And actually, we should not say that India is not giving seats, but the thing is, we were not able to get into the medical college.
It's true.
So, and after going abroad, means many people think that the MBBS won't be that easy or that hard. It's moderate. I would like to tell everybody that it's moderate and it's doable. It's not like that no one can do it, and if somebody is doing it, it means he's a very great guy. No, every normal person can do MBBS, and he or she can become a great doctor. So my university experience is really very nice. Amazing friends I got, and that was ice on the cake, man.
So what I want to add here is that when I took my admission, Nikhil was still trying his second attempt that time, and Nikhil once randomly called me that, man, how it's going and how's your Russian university and all that. And I think I have advised him that time also, it's better to come here rather than wasting your time in India, because it's not about your your preparation or strategies, how you prepare for each attempt. It's about the number of seats also, and about other categories and quotas. So in India, it's very saturated now, because recently also we have seen the news, 25 lakh students are appearing for NEET UG 2024. So how you gonna score that much? Of course, you can try, but it's like a 0.1% chance that you will get your desired college or desired MBBS seat. So that's this is the better option that we have tried, and I think it's the best option. So I guess it was destined to be destined to happen like this. My next question to you is, Nikhil, see, nowadays there is a wave of different coaching classes for NEET UG. Different coaching classes are there, and everyone says we are the best and come to us and study with us, we guarantee you the success. But after the result comes, no one is there to accept your failures, or no one is there for you. So what you are doing in life, and no one asks you anything. They are just like a machine of printing money, I will say. So what's your view on this for upcoming new NEET UG generation? Because as we see that 25 lakhs registrations applications are there for this year.
First thing is, coaching classes can give you perspective. They can't guarantee the success. In this world, nobody can guarantee success unless and until you are that much strong enough to do the hard work. Then only you can say that 100% I'm gonna succeed. But the thing is, you have to take a wise decision while choosing a platform or choosing a coaching class, because everybody is doing the advertisement of the same thing, that yes, success is guaranteed with us. Everybody will say about success, but nobody will talk about failures, because in success, everybody is near you, around you. They will surround you just like nothing. You have dealt the harshest situation in the world by facing NEET UG. I truly believe that. And success brings you a lot of joy, but failure, you are the only one person around yourself who will be facing the consequences, and who will be introspecting that what I should have done and what I'm getting right now. So please make a wise decision. Please think rationally. Don't believe in everybody's commitment. Try to be much more rational in the matter of NEET UG coaching classes. Everybody is saying the same thing. If you believe in them, if you believe that they will be able to help you in your journey, if you believe that they will be able to give you something much more better than somebody else can give, definitely you should go and join them. Next thing is, don't study from several other materials. Try to stick with one, because you should read one book thrice instead of reading 3 books 3 times. One book 3 times is always better, and that would help you immensely, because we have done the same thing in MBBS as well. Because so my view is, please ये भेड़ चाल में नहीं जाना है. Always think rationally, always think practically. Whoever can help you, please go and join them. You'll get the success, but hard work is the ultimate key to success.
Yep. Yeah, that's what, like, first attempt is always the, whenever you do your first attempt in
most it should be attempt first attempt.
First shot. It's always, the first shot is very important, because if you get nearby your goal also in that shot, it means like you are made for that field, or you're just good to go with that. So because we have our bit of past, we know that, like how we suffered for NEET UG preparation. So now after all this, we have like seen this success of FMGE and like first shot, and that's what keep going, like perseverance every day.
I would like to mention one more point, Chinmay. Yes. And I'm telling you guys, please don't believe that those who are trying to depress you, they are the biggest killer of your own self. उनकी बातें नहीं सुनना is the nicest thing you can do to yourself. Yes. So please try to surround yourself with the nice people, with the good people, likely-minded people, those who try to bring out best in you. Definitely, you'll kill it.
Next question. My question is regarding preparation strategy. Like, what was your preparation strategy, subject-wise, like clinical, medium subject, and the short subjects?
Actually, most of the time, our motivation to study big subjects is comparatively much more better than any other subjects, because we know they are the scoring subjects. They will give us a big chunk of marks and all the things. Yes, mostly 130 to 150. These are the big subjects we think. But I would like to add one more thing in it. Those big subjects can be read and they can give you a benefit only if you study all the preclinical and the paraclinical subjects that you have studied thoroughly. So if you are thinking that only big subjects can give you a good amount of marks, that's correct, but they are backed by all the preclinical and paraclinical subjects. And next thing is, when we study anatomy, physiology, and biochemistry, they are everywhere in the medicine. Everywhere they are there in the surgery. They are there in the OBGY. Everything is there. So you have to be thorough with the preclinical and paraclinical subjects. First of all, first year subjects are one of the most important, which we think anatomy is comparatively difficult to understand as well as to completely integrate, because it's completely held into surgery as well. So if you do all the subjects, anatomy, physiology and biochemistry, they will help you everywhere. Pharma is just like a potato, it goes in every curry.
Yes.
So you have to be thorough with that. Next is micro and microbiology. That is also just of the same kind.
Yeah.
So all the subjects which are anatomy, physiology, biochemistry, and second profs micro, patho, and pharma. I would like to mention something about pathology. Pathology is a very vast and big subject.
Yeah.
But if you study it, you'll never regret.
Yes.
You'll never regret, because you'll get to know each and every disease which is going to come in medicine, which is going to come in surgery, and all the diseases, all the clinical subjects is completely integrated with the pathology.
Yes.
So we have to be thorough with pathology as well. And next is third prof, ENT, ophtha, and FMT, and other subjects, minor subjects along with that. ENT and ophthalmology are one of the most important subjects which can be very scoring, as well as most of the questions are not so badly twisted in them.
Yes.
Just like medicine and surgery.
Yes.
But pretty straightforward questions come. But actually in Jan 2024, we were not that lucky.
Next question was that only.
Yes. In that sense, we were not that lucky in the matter of ENT and ophtha, because they are one of the strongest subjects which people think, and actually they are. But they were quite critical in the exam this time. I was hoping them to be simple, but definitely they were not that easy. Yeah. And they have told us in Jan 2024 exam, they have told us, please don't call FMG as a FMG. In my words, I call FMG as a NEET PG prelims, because they are trying to prepare us. They're trying to prepare us for NEET PG, and there is no difference nowadays in NEET PG and FMG. If you study directly for NEET PG, you are definitely going to crack FMG, because syllabus is the same and pattern is same, everything is same. Even though it is recommended to all the people, those who are doing FMG, you have to solve last 4 or 5 years of NEET PG papers, because they will give you a very strong insight that what examiner is trying to ask. So my view is, please don't leave any of the subject, because each and every subject plays a very important role. Because orientation of all the 19 subjects in an integrated manner in the clinical approach is very much necessary, because your understanding will be not that great if you leave some subject, and if some question is integrated to that subject, you'll mess up with the question. Reading concepts every day is necessary thing, but if you don't solve questions along with that, you're making a big mistake, because you don't know how examiner is trying to ask the question. You're familiar with each and every concept, but if you don't know how examiner is trying to ask you the question, then you'll mess up with the question. And next important thing is dedication to pass the exam.
Yes.
Because many people lack in that only.
Yes.
They do hard work sometimes. And their consistency is broken every single day.
Yeah.
It happens with everybody. We lose our flow sometimes. But you have to get back into flow. You have to be consistent with all the 6-7 months which you are going in coaching or doing offline or or doing by yourself. That is pretty important, because last few months of the exam are very crucial and critical.
Sure, that's great advice. And one more thing I want to add here is that during this preparation phase, you might be preparing like offline mode, what Dr. Nikhil has done, or like me, what I have, like I was at home and preparing on my own without having any subscription. And it's possible. It's possible either ways. It's possible. The only thing is keep going, and you have to believe yourself, because see, even if we are saying it now, but what we had experienced that time, we were also nervous, we were also impatient, we also had some mental health issues going on in families or around us, because it's very difficult, because everything changes after you leave your universities. So you have to keep going, and you have to keep a little bit of patience. Sometimes you will lose patience also, but it's like being a normal. It's normal. So that's what the key is. And about the paper pattern, before we discuss about Optha and ENT, it was like new thing. Whatever we got along with Optha and ENT.
Paper pattern is yes. I would just say like that. Paper pattern. We were familiar with the paper pattern.
Yeah.
But the criticalities in the question, just like questions were very much twisted.
Yes.
And English was just like means we were sitting. Yes. I was going to say that. Means we were sitting with one of our professor and we were discussing the questions post exam. Yeah. So one of my friend mentioned that they must have called somebody from Oxford, those who have a very great vocabulary and skills to develop the English questions. Yeah. And I think doctors are not preparing these questions. Somebody from Oxford has came to design the question. So next is, please be clinically oriented with each and every subject. Because nowadays exam is getting 101% clinical. If you know that thing, 101% try to make application of that. Because if you know how to apply it, you will be able to solve the question. In each and every question, you will find one patient. Yes. You are dealing with patient in each and every question. So don't think that you are sitting in the chair and just solving the questions. You are in the clinic, or you are the physician, treating physician, and you have to think like a clinician. Detailed knowledge of all the 19 subjects is very important. I have seen, I'm not derogating anybody, but I have seen myself, people not having that clinical knowledge because they are trying to study rapid revisions of each and every subject. Please, my humble request to all of you, don't do rapid revision unless and until you have studied the whole subject nicely in the detailed manner. Yep. Rapid revision is for those people, those who have a detailed knowledge of all the subject and they are just trying to brush up their concepts as they are and they are just trying to look over the subject. Please, but it is very harmful practice which will take you to a situation from where you won't be having any chance to go out of it. Please don't do that. Detailed knowledge of all the 19 subject is important. Next is, please do those PYTs of NEET PG as well. Yep. PYT, I'm saying, not PYQs. Yeah, PYT, topics, previous year topics, which are important in NEET PG, because sometimes some concepts are relevantly most probably asked in FMG, but we have seen that some NEET PG questions directly come in FMG also. Yes. So we have to be thorough. We have to be thorough with those topics as well, which are asked in previous year questions of the NEET PG. So all the preparation should go on both the hand in hand. NEET PG as well as FMG, they are not nowadays different. They are becoming one and the same. So please don't differentiate them by the name. Just by giving them equal respect, we can attain all the things. And this is my humble advice to everybody.
One more thing I want to add here is this: in this exam, FMG exam, what we had recently, they are asking every kind of different kind of questions. There will be multiple choice questions. Absolutely. Will be there, like match the followings. There will be 2 answer questions. Will be there will be little less, but there will be. And about one-liners. One-liners, I will say, even if the topics are same, but the questions are not same. Every year they give the new one-liners, and this year also happened the same. There were lots of one-liners, those I guess no one has seen before, and that was a point where a lot of students lost their marks. It happened with me also. After coming home, I have seen my 10 to 15 questions where I have lost it, because I know I thought those were PYQs, but there were some twists in that. But I was lucky somewhere, at some point, that I thought a little bit more critical and did them right. But at few points, I do made them incorrect. But nothing to worry. If you are good with your concepts and if you are determined enough, you can crack it. Why I am saying this? Because we have 2 chances to pass the exam, like part 1 and part 2. So you have to score just 75 in one and 75 in second part. So what you can do is you can score at least 100 marks in any one of the paper, and remaining the next part will be taken care by your subconscious, I will say, because 50 marks you will score for sure if you have studied clinically. So that was my preparation strategy, I will say, and my thought process, because I wanted to clear in first attempt. It was not like for me to get like the 250 or 300. What's your take on the one-liners this time?
One-liners were very deadly. They were very cruel to us. If you know it, you know it. If you don't know it, it has gone. So actually, what we are thinking is exam is getting clinical day by day. That is 100% correct. But they are trying to check your memory as well by knowing the one-liners, because they know you are trying to judge the thing. Everything you are going in the judgmental way, because you have to judge in the question that patient is this. You have to do this, and things need to be done like that. But they want you to have certain things in the memory for sure, because if you know certain things for sure, definitely you'll be able to apply it. Means just like a factual things are hard to remember, because we know we are habitual to learn the concepts from our NEET UG days. So, yes. So conceptual things we can do it by hook or crook, but for the one-liners, they are very deadly. And I would suggest one thing: please do previous year questions of means 2000, after 2012 to 13 to 2016-17. They are having pretty much one-liners in them, and before that also one-liners was a very good trend in the FMG. So please have a look on them. They will give you a very good insight. And next thing is one-liners, clinical questions, and straightforward questions. These are the three types which we can understand in the paper. So if you prepare for all these three types, definitely no one can beat you in this process, and you will have that great success in your hand. First paper was too much factual this time.
Means I was like,
we didn't expect. We didn't expected that paper to be so much factual and one-liners. Pretty one-liners were there, and PSM is the subject of factual things. We have to memorize the thing, we have to learn the things. But as a medico, we are not habitual for the calculations and all the things.
No.
But PSM are having important formulas to calculate, because when we work in PSCs in the government sector to get the funds and all, we have to calculate many things. So calculation part is one of the important part, and which most of the medico lack. I know that few of them have a very great skills of mathematics, but I was pretty bad in that, and definitely that has hampered my 5 to 6 marks in PSM, because I was not able to calculate. Even the calculator was provided on the screen, desktop screen, but still you don't have that mentality to go and calculate them.
Yeah, agree.
So yes, so the calculation part was hampered, and I lost my 5 to 6 question in that calculation part. So I would tell everybody, please focus your part of PSM with the ultimate give high respect to PSM. Next is please don't leave all the small subjects, all the 5 small subjects, because they are very important. Because if you leave all the 5 subjects, definitely you are going to lose 25 plus marks.
Yes.
They are the scoring marks. And if you leave them, one thing will happen. If you don't have the point of view of radiology, you'll miss out many images.
Yes.
Many images. And please do justice with the radiology, because you will get X-rays, you will get CTs, you will get MRIs in every place of the every medicine question. Medicine and surgery will be full of CTs, MRIs, X-rays, and all the things. USG scans, EFAST, all will be there. So please have the good insight of radiology. One of our great radiology professor used to say, if you think you'll get 5 questions in radiology, you are mistaken. Please try to consider 20 questions at least, because you will get radiological images, different subjects as well. So please try to have a good radiological insight as well. Next is derma will be integrated with microbiology. So please study derma and microbiology simultaneously. And psychiatry will give you a good 10 to 8 questions, 8 to 10 questions of site. So 30 questions, 30 plus questions will be there from these five small subjects, and please don't dare to leave them. You'll be in a great loss. So my point of view would be, please study those subjects thoroughly. Easy questions will be there. You don't have to struggle too much with those questions, and you'll get good marks in them.
Next question I want to add into it is exam day mindset, and how to tackle each and every question. Why I am asking this? Because Dr. Nikhil has 180 score, and I had 169 score. Different mindset you will get.
Yes, I would tell you,
and I will also share mutual advice on that. So
yes, absolutely. So scoring 10-15 marks more is not a big deal. You have done the same thing what I have done. But thing is, keep yourself calm and composed on the day of examination. Because if you get into the anxiety of solving questions, each and every question, please don't take as a dare to solve each and every question. That's the worst thing we can do in the exam. If you don't know the question, skip it for the rest of the time and try to shift your focus on the next question. Because if your attention is drawn by one question, your complete energy will get drained into the same question. And please don't let that happen. Because if you take it as a challenge, definitely you lose that battle there then and there only. Because you have to skip the questions. There will be few questions. I'll tell you, nearly 50 questions will be there which will think that they have not studied them. 25 to 30 questions will be there. You think I have studied somewhere, but I'm not getting the complete idea of it. And nearly 180 to 200 questions will be there. You know that I have to put my mind, I have to put my analysis, I have to put my decision making ability in them, and then I'll be able to do that. Would be, please don't change the answer. Once you keep it, you keep it. Because your intuition, your subconscious mind is giving you an idea. You have read it somewhere, you had that question in the q bank or somewhere, your professor has said something about it. You get all the recalls, but not in the form of pictures, but in the form of intuition. You have to listen to your intuition that yes, this is the answer, and let's go for it. And 100 out of 80 times you'll be right.
Sure.
So this was my strategy and the things related to the exam.
So pretty much same was mine too. So this subconscious thing has helped me a lot, because I know in the first part I knew my questions are wrong, and I was pretty sure, because you know when you make mistakes. So after coming out of the exam hall, I was like, okay, whatever happened. It's a past. Now coming paper, I will do my best. And everyone was saying on center near around me that paper was very easy. Part 1 was very easy, and I was like, really?
Yes, correct.
Really, it was easy. I said, then I got some different thoughts in my mind. Probably I had not good preparation or something. Then I said to myself that it's okay. Whatever happened. Now come to the next part. I will do my best, and I have set my goal to cross I have to solve each and every question thoroughly and very nicely, because I should not lose this battle. So I have gone to the exam hall, sat for some time, slept, took some sleep, because you have one and a half hour before the exam starts. So you can do that also to calm your mind, and don't try to talk before exam starts to anybody, because this can disturb your mindset too. And apart from that, there will be examiners coming in for taking your thumb and other remaining biometric formalities. So that can also disturb your mindset. And don't get nervous while solving the questions. Whatever grand test you solve at your institute or whatever your online platform you have, never try to compare it with your final score. That sometimes you will get 149, sometimes you may get 160, sometimes you may get 200 plus. So it's not 100% sure that you will score the same marks in your final exam, because the last exam day is one of the crucial day in your life, because it's completely different scenario, and you will get a lot of new things, you have to think a lot. Apart from that, there will be image-based questions. Those will be totally different. For example, this time we had an image of heart. Maybe and there was just to see the image, and there was just arrow pointed out to it. What's this? Like left atrium, right atrium, or whatever other parts. So it may be pediatric heart, or maybe something else like adult heart. We don't know it. So you have to be a bit careful while looking at the image. Also, you have to see the direction. There will be directions given like left, right, up, down. So it's important to prepare from every aspect for this exam. So prepare for the worst, as he also said, and my strategy was also same. Prepare for the worst, because you have to clear it in first attempt. Because after this, your process gets little bit much easier, because you know that you can do it, and it gives you boost for your NEET PG. So that was the thing. What's your advice for all the juniors and the students or our friends who didn't pass this exam? or the student who are trying more time, like a lot of times, like there are a lot of students, those who didn't clear the exam in third, fourth, fifth attempt this FMG because probably they have done some mistakes during their university days. So what's your take on that? I will add my points also to it later.
I would like to say first thing is once a failure is not always a failure.
Good.
Because failure doesn't signifies your ability to means mark this world out of anything. Because I know many of the people, those who are highly studious, means they were studying much more better than what we did in the MBBS profs.
Yes.
I'm telling you, I have seen people studying for 10 plus hours a day, and still they had a backside in the exam. But that was not because of their they were not persistent or they were not hard work. They were not oriented.
Mm-hmm.
Biggest thing was they were not oriented. I mean, this clinical knowledge was not that brushed up in that part. So if you have had a setback on 130 to 150, that's not a failure.
Yes.
That's just by luck you had a bad day on
Yes.
the exam day. So if you put the medal on the pedal and if you try one more time with ultimate dedication and hard work, definitely this upcoming June exam will be the last exam which will appear and get passing certificate of. For the people, those who had not made this time, I'm telling for those people, if you're good in some subjects, please try to revise those subjects. But if you are bad in something, if you are very much crucial in solving some questions of some means example, if I'm taking example of PSM, try to give more focus to PSM. I'm not saying that you should not study all the 19 subjects. That's a compulsory fact. But if you have to focus on some subjects, that will be PSM and OBGY, because these are volatile subjects. Sometimes you get to fumble in them. Next is all the preclinical and paraclinical subjects. Those are one of the most important subjects in them, because the clinical knowledge starts from them. They are the initiator of knowledge, and if you work on them, definitely you'll had a very great success. Next thing is, you should have a strategy of solving MCQs. Every time reading 100 means, if you have a paragraph of 7-8 lines, you should have a habit of finding keywords in them, buzzwords in them, because that will save your time. That will give you an insight of the question in a fraction of seconds. And if you have the insight of the question, you know what is the answer. So first thing, the answer comes in your mind before seeing the options. That is the most correct answer I can tell you. That if you have the answer before seeing the options, definitely you know the answer. Next thing is GT. Solve as much as GTs as you can, but please don't compare your GT score with the ultimate final score which you are getting. Please add 10, 15 plus and minus in them, because that can fluctuate. Anytime that can fluctuate. Next thing is, I would like to advise this time, July 6th is the exam, I guess. So July 6th is the exam. Please don't solve any GTs 10 to 15 days before the exam, because if it goes well, definitely your confidence will be boosted up. You'll be roaring just like a lion. But if you have a discouraging GT, that can break your confidence. That can break your rhythm. Last thing is, don't worry about the result. Believe in yourself, क्योंकि हमेशा हमेशा try to say yourself कि हम भी दरिया है, हमें अपना हुनर मालूम है, जिस तरफ भी चल पड़ेंगे रास्ता हो जाएगा. So try to thank you very much. Try to have that mindset. Keep yourself calm and composed. Study nicely. Easy. दिन में 4 घंटे भी पढ़ते हो, that is easy. No worries. You'll make it.
So that was the podcast, guys, and I want to thank my friend Dr. Nikhil for coming to the podcast and sharing his views and perspectives. Apart from that, I hope you all have got the valuable message through this podcast. So keep enjoying, and next Sunday again at 10 a.m. I will be coming with another podcast with another guest. So till that time, keep watching Earthly Existence, like, share, subscribe, and don't forget to comment also.